Smith safe. Okay, Mrs. Smith, we're going to get ready and wash your back now. So I'm going to turn you on your side. So if you can cross your arms for me. Okay, and cross this leg. That'll just help facilitate things. And look towards me, my gloves are clean. Okay, hand on hip and hand on shoulder. 1, 2, 3. Doing okay, Mrs. Smith? Keep you covered as your head, okay? Good. There, if you can hang on to that side rail, that would be wonderful. Now I'm going to take my towel and I'm going to lay it along the bottom of Mrs. Smith's back on the bed. Oh, that water is nice and warm. Nothing feels as good as getting your back washed and rubbed, huh, Mrs. Smith? Okay, so here we go. We're going to start at the base of the buttocks. I'm overexposing her right now so you can see. Starting at the base of the buttocks, making sure that she's not soiled with feces or anything. Coming in an upward motion, going up and around the shoulder, and coming back down through the middle. We continue to do this until we feel like we've gotten the whole area clean. And we're going to rinse in the same fashion. You doing okay, Mrs. Smith? It's hard to stay on your side, isn't it? And again, I'm observing for any open areas, any redness, any complaints of pain. Okay, we've washed and rinsed, and we're going to pat dry. How would you like a nice back rub, Mrs. Smith? That sounds good? Before we give a back rub, we always want to check with the nurse and the care plan and make sure there's no reason, such as any heart or cardiac conditions, that would warrant Mrs. Smith not having a back rub. Her nurse said she's good to go, so we're going to go ahead and give you a nice relaxing back rub. We do this for 3 to 5 minutes. You can do it with or without gloves. If the resident has any open areas on their back, any kind of drainage, you certainly would want to wear gloves. We want to warm the lotion between our hands very well so our resident doesn't scream. Okay, Mrs. Smith, you're going to feel this lotion now. So we're going to start down here at the base of the spine on each side of the cheeks of her buttocks. Come up, go around the shoulders, come down, massage in circular motions and long strokes. That's going to put you to sleep, isn't it? Get in near the spine. And then we're going to take our fingers and our thumb, and we're going to do like a kneading sensation, as in kneading bread. But we're going to be very gentle on elderly people or anybody in pain. How you doing, Mrs. Smith? Okay, and then we're just going to finish with a few long strokes up and down the back. If you feel like there's excess lotion when you're done, you can go ahead and pat dry because you don't want them slip sliding all over the bed. Okay, Mrs. Smith, come on back. Oh, I'm so glad that felt good for you. In the hamper goes this. Okay, now we're going to get you dressed in a nice clean gown. Yeah, I know after that rough night you had, you've got to be feeling better. And hopefully you can take a little nap now, and when your son comes in later, you'll feel all fresh and like visiting. So one way to dress somebody without exposing them when the bath blanket is on is to simply have the gown go on top of the bath blanket. Mrs. Smith does not have an affected arm, so it doesn't matter which arm I dress first. And now all we simply have to do is pull the bath blanket down. We're going to leave it at her knees for a few minutes. Okay, we're going to go ahead and tie this gown in back. Not too tight, not too loose. How's that feel, Mrs. Smith? Yeah, we'll get your hair combed too. As part of a bed bath, we would also do peri-care as well, but since that is another skill and it's state tested, you'll see that in another video. So I'm going to go ahead and remove my bath blanket because it's damp. Pull up the covers. I'm going to remove my gloves. I'm going to decontaminate my hands. Here's your call light, Mrs. Smith. Can you reach that? Oh, good. Okay, I'm going to lower the bed, lower your side rails. I would take my dirty water, empty it in the toilet in the room, rinse and clean out my basin, put all my supplies away. Make sure Mrs. Smith doesn't need anything else. You gonna take a nap right now? Oh, I'm glad to hear that. Okay, I would come around and lower these side rails. I'm going to put on another pair of gloves to dispose of the water since the basin has been used, and put my supplies away. Well, you have a nice visit with your son, Mrs. Smith. My gloves are clean, so I can go ahead and open the drawer with my clean glove. Put my supplies away. I'm going to leave it open. Dump this in the sink, and again, in clinical setting, it would go down the toilet. Or rinse and clean it. Okay. Now I'm going to push back the curtain, and I'm going to wash my hands, and the complete bed bath skill is complete.